Mohammad Ghaznavi. I'll be your interrogator today.
Okay.
Can you confirm your name, please?
Dr. Hamna.
Okay, Dr. Hamna, your mock number?
Mock number 4.
Mock 4, right. And your exam date?
24th May.
24th of May. So, on the behalf of M&M E-Institute, I'm conducting this session.
Okay.
So, have you received the card, right?
Yes.
And you are prepared for the session?
Yes.
Okay.
Hi, my name is Dr. Hamna. I'm your doctor today. May I ask your name, please?
Well, my name is Michael.
Okay, Michael, can you please confirm your age?
I'm 65, doctor.
Okay, you're 65. Okay, so why are you here today?
Doctor, actually, I need to ask you a few questions. I have applied for an early retirement because I believe that I'm having Alzheimer disease, and for that reason, I just want you to have the refer me for genetic testing since I have a very positive family history of Alzheimer disease.
Okay. I'm really sorry to hear about you're experiencing some symptoms. So, if you don't mind, may I ask you some questions, please?
Yeah.
Okay. What is your knowledge about Alzheimer's disease, or what do you know about Alzheimer's?
Well, as I mentioned that I have a positive family history. My father, my elder sister, they both have this condition. So I do know that the people who are not able to manage things up, since I was having issue in managing my workload.
Okay.
I was unable to complete the task. Sometimes I would forget the things up. So for that reason, to be on safe side, I just want to have the genetic testing since I have a positive family history, and I believe and I heard that it's run in the family.
Okay. If you don't mind, may I ask you something?
Yeah.
Do you have any queries related to do you know what memory loss is, or what is dementia? Do you have any information regarding
No,
it?
I just have an idea that this condition like Alzheimer might be the memory loss or dementia are associated condition in your medical language. But what I know they are related to the management of your memory. Maybe you are unable to manage the things up.
Okay. I completely understand your concern. It might be very devastating for you just to experience all these symptoms. Okay. So, do you have any questions related to dementia for me? Do you want me to explain it or to elaborate it to you?
I am really worried about the concern about one thing that I need to confirm if I am having all the symptoms related to dementia, Alzheimer, whatever you're saying.
Okay.
For that reason, I just want you to have this genetic testing first.
Okay. Let me explain to you. Firstly, we basically need to understand your condition properly. It's not always Alzheimer's. You might be experiencing dementia or memory related problems or other problems due to some other reason. So basically we need to investigate it. Basically we need to see your symptoms in detail. According to my point of view, I just want you to see a neuropsychologist just for a review, just for the assessment and further evaluation, because you might be having some depression or anxieties or some other.
I am really worried about this thing now. You mentioned that I can be having depression. I never had such problem.
Yeah, I completely understand. I am here to reassure you that it's not a big deal. Like, you can just visit a neuro psychologist and he can just rule out some diseases for you. It would be a great help for you towards your diagnosis. If you're understanding me, are you clear? It would be very helpful for you.
Okay, so you're saying that I should go for neuropsychologist first before the genetic testing?
Before the genetic testing, you must visit. It would be helpful to you, and we can just rule out some other things. There might be some other things I think so that we must not be very much aggressive towards your diagnosis. Okay. Like, we should not go directly straight for the genetic testing for Alzheimer's. We must think about some other diseases also. Okay. So are you getting my point?
Yeah, I'm following you.
Okay, that's good. Okay, so basically, we need to see your further assessment and possibility of some other diseases, as I mentioned before about depression or something else. Okay. So, am I clear in my point of view? Okay, should we move forward?
Yeah.
Okay, thank you. Basically, before going to the genetic testing, as you know, it's a big test, and I need you to have a counseling with the genetic consultant. Do you agree on this point with me?
Yeah.
But it would be very good for you. Basically, you will be counseled about the procedure, about the risk factors and the outcomes and everything you need to hear about it.
Okay.
So it would be good for you.
Okay, doctor.
So you need to see basically a genetic consultant before going for this test.
Okay, I will definitely.
And he will guide you about this testing.
Okay, doctor.
Okay, so are you okay with it?
Yeah.
Am I clear in my point of view?
Yeah.
Okay, I wish you a very speedy recovery. Thank you for
Thank
the
you very
visit.
much. Thank you very
Thank you
much.
very much.
Okay, now we'll give you a live feedback over there.
Okay.
It will be like brief feedback.
Okay.
Greeting is fine. You can you have started with the confirmation of the name and age. However, it can be discussed when you are preparing the card with the patient, right?
Okay.
It's still fine. Started the conversation with open-ended question. It's absolutely fine, but I can suggest you some alternative question that can be used from the history component. Like, I can see from your file that you are having blah blah problem. Can you tell me in your own words? That's more
Okay.
better word or the lines for the open-ended question in this specific scenario.
Okay.
And then we can say the attentiveness skills. It's one of the skill in the personal relationship building skills. After listening to the patient complain, you have to recapitulate, repeat into your own language, right? That was missing, by the way. Similarly, for the empathy part, although you have empathized, but it can be considered as a fake empathy. Why? Because you listen to the conversation, then you said, okay, okay, oh, I understand that, right? So it should be immediate empathy. Oh, I understand about your whatever.
Okay.
Okay. In any scenario, whenever you are going to listen to the patient complain, so it should be immediate. It should not be having a pause or a fixed
Okay.
empathy statement. Okay. Over here. You have explored the patient knowledge about the Alzheimer disease and dementia. That's a positive point. I guess that you have not explained in detail about the Alzheimer and dementia.
Yes.
Yeah. And more thing that like that's something, you know, like we might not have all the points written in the card. Sometimes you may have to drive the things from the patient response. Like if I'm saying that I'm having problem in managing my workload, there is a point you can ask some close-ended question over here related to the dementia, right? Okay, some close-ended question that can help you to confirm if it's dementia or not, right? Anyhow. Secondly, the second point was confirm. You consult the patient appropriately, followed by you can say all the points have been covered completely, right? Fine, okay. So repetition of certain words, such as basically you're repeating multiple time, just that being used multiple time. Detailed pronunciation is appropriate, but just to polish that pronunciation again. Your fluency pronunciation is also fine. We are not using any cohesive devices like firstly, secondly, thirdly. It's better to use the cohesive devices in your speaking scenario. Like first of all, the first thing first that I would suggest you to go for the generating counseling before going to any other procedure. Now, secondly, after this after the neuropsychological referral, then we may consider about the generating counseling if it's necessary or if it's being recommended by the specialist, right? And last point that I would like to mention, we prefer not to use the lines such as "Are you getting me?" We prefer use the line that you have used later on. Am I clear to you? If I am understandable to you, that's better. You are not judging the patient judgment.
Okay.
Right? So these lines should be used. But I appreciate your speaking. It was very well managed card. I believe that with this speaking, you can easily qualify the speaking part
Thank
with
you.
more than 360, 70 score, hopefully. Okay? Any question that you'd like to ask?
No, thank you.